Hello everyone. Greetings from the Indian Journal of Anaesthesia. I, Dr. Shayak Roy, is going to present this narrative review titled Various Biases in Systematic Review and Meta-Analysis and Their Assessment, authored by Dr. Abhijit S. Nair and Dr. Nitin K. Borkar from the Department of Anesthesiology, IBRA Hospital, IBRA, and Department of Pediatric Surgery, AIIMS Raipur, Chhattisgarh. Systematic reviews and meta-analysis synthesize existing evidence to inform clinical and scientific decision making. Biases have the potential to compromise the validity and reliability of results. Accurately interpreting systematic reviews and meta-analysis requires understanding these biases and how to evaluate them. The present article describes the commonly encountered biases in systematic review and meta-analysis and the methods utilized for risk of bias ROB assessment. Randomization is an essential aspect of RCT. The random sequence generation techniques and allocation concealment of the RCT must be considered to evaluate selection bias. A truly random sequence for treatment allocation means that the baseline characteristics of both groups will be naturally balanced. Sequence generation refers to how patients were randomized to the treatment groups. However, a bias in how the allocation is performed could result in differences between the comparison groups. Meticulous allocation concealment could prevent anyone from being able to predict or deduce patient allocations. There is always a chance that patients who have been enrolled in an RCT will leave the study before finishing their follow-ups. Attrition bias occurs when the subjects withdraw from the study, thus affecting the study's result. The withdrawal imbalance may impact the study's finding and conclusions if a reason for withdrawal is present or more common in the comparison groups. Results would be affected if a particular patient group within one of the comparison groups had a greater probability of discontinuing the study. Detection bias refers to the possibility of differences between the comparison groups regarding how the outcomes are measured or assessed. To reduce detection bias, the outcome assessor should be masked. This ensures that the methods used to measure an outcome are the same for all the study participants. When reservations arise about the findings presented in a study's result, reporting bias may arise. This usually occurs when a study reports significant outcome findings while leaving out the non-significant one. This emphasizes the significance of a predetermined study protocol that specifies all the outcome that will be evaluated, even though it can be challenging to identify. Publication bias occurs when the published literature, which frequently favors studies with positive or noteworthy findings, does not represent all research on a topic. Positive results are more likely to be published in journals, which causes the effects of interventions to be inflated. Statistical tests such as Eggers test plots the effect estimates from individual studies against their standard errors. This can identify asymmetry in study effects using funnel plots to evaluate publication bias. There are some tools for assessing the risk of bias. The most commonly used ROB tool for RCTs is the Cochrane ROB tool using Refman program, which uses the following things as mentioned in the graph. The ROB2 tool was developed later to address a few concerns with the Cochrane ROB tool. Risk of bias in non-randomized studies of interventions, Robbins-I tool, used to assess the ROB in estimates of an intervention's safety or effectiveness from research that did not assign intervention using randomization. Risk of bias in non-randomized studies of exposure, Robbins-E tool, is used for assessing the risk of bias in observational epidemiological studies. The component of Robbins-I and Robbins-E are mentioned here. A traffic light plot is a visual representation of risk of bias. It uses color scheme like traffic lights, red, green, and blue, to display each result's domain level judgment. The distribution of ROB assessment within each bias domain is then displayed in a summary plot or weighted bar plot. The height of the bars represent the proportion of studies with low, unclear, or high ROBs. For the assessment of bias, two authors perform the ROB assessment for all the studies that form the inclusion criteria. If there are discrepancies, a third author must take a final call to declare the category of bias. A study is deemed to have high ROB if any domain suggests high risk. A web application called RobVis can be used to visualize ROB analysis carried out as a component of systematic review. This tool generates weighted bar plots of the distribution of ROB judgments within each bias domain and traffic light plots of the domain level judgment for each result as described earlier. The final ROB for each domain is entered in an Excel sheet, which is then uploaded to the web app to generate the plots. There are some other tools for assessing risk of bias, like Jadad score, which is a system which uses 8 criteria, as mentioned here, to assess the methodological quality of a clinical trial. High Jadad scores indicate better studies. Scores of 3 to 5 usually indicate high quality trial. Another tool is Newcastle-Ottawa scale, which is an 8-item instrument, as mentioned here, to assess the quality of studies in clinical trials. It is divided into 3 categories: selection, comparability, and exposure for cohort and outcome for case control studies. It provides a rating system using star ranging from 0 to 9. Scores equal to or greater than 7 considered high quality. 1 star for each item in the selection and exposure categories is assigned. For comparability, a maximum of 2 stars may be awarded. Studies are categorized as good, fair, and poor based on the star in the 3 dimensions. Quality assessment of diagnostic accuracy studies QUADAS tool was developed for systematic reviews of studies on diagnostic accuracy. Later revised into the QUADAS 2 tool. There are 4 domains of QUADAS 2, which are patient selection, index test, reference standard, and flow and timing. ROB is evaluated for each domain, and signaling question can help judge the ROB. The QUADAS 2 tool is used in 4 stages. First, during the summarizing the review questions. Second, while tailoring the tool. Third, producing the review specific guidance. And fourth, during constructing a flow diagram and evaluate bias and applicability. So to conclude, the systematic review and meta-analysis are effective instruments in evidence-based practice. Their validity depends upon the meticulous evaluation and reduction of biases. By being aware of and addressing these different biases, researchers and clinicians can more confidently interpret findings and increase the impact and dependability of their conclusions. Thank you.